Hi everybody, I'm Dr. Jon LaPook. Welcome to CBSDoc.com. It's back to school week and everybody's talking about H1N1. We're lucky enough to have our new commissioner for the Department of Health in New York City, Dr. Thomas Farley. Welcome.
Thanks very much.
What's going on right now with H1N1?
Well, we saw some H1N1 here last spring, and then it went away in July. We've been planning all summer, assuming that it'll come back sometime in this fall and winter. And we've put a lot of things in place, and so we think that we're fully prepared for when and if it does come back.
How does it look right now? Are we seeing a lot of cases?
There are cases of H1N1 or influenza-like activity, at least in many areas of the eastern coast. We're not seeing it in New York City right now, but we certainly expect it'll come back at some point.
I saw there are 5,000 new cases in colleges. Why do you think we're not seeing it in New York City, whereas we are seeing it there?
Well, we certainly had an awful lot of people that became infected in New York City last spring. We did a survey that estimated between 750,000 and 1 million New Yorkers got the infection. Now, the majority of them didn't even see a physician. It wasn't necessarily a severe infection, and the vast majority of them recovered in a matter of a few days. But because of that, the large number of people who were infected last spring, it may be that we'll see a little less in the fall.
Presumably, the people who got the infection are then immune from getting it again, right? I mean, in 1918, when there was that big influenza that killed so many, killed 40 to 100 million people around the world, the people who got infected in the spring when it was relatively milder were relatively protected the next fall when the deadly wave came. So I think that's why some people were saying, well, we should have swine flu parties, right? But CDC recommended against that.
Yeah, I wouldn't recommend that, but I would say that people who had the infection last spring are going to be protected. One of the things we know is that this virus has not changed from what it was last spring to now. We know that from the pattern of illness that it's caused when it's traveled around the world, and we know that from laboratory tests that indicates that this virus really has not drifted. It's the same virus we saw in the spring, and that virus was in general a mild infection.
Right, and it seems to be more communicable than normal, but really not more deadly than normal. I mean, in a normal flu season, about 1 in 1,000 people die. That's 36,000 Americans every year, right?
Right. In New York City, we estimate we have about 1,000 people per year that die from seasonal influenza. We had some 50 deaths in New York City last spring, which is tragic. As a physician, I don't want to see any deaths, but It's many fewer than we see each year from seasonal influenza, and that's a tiny fraction of the total number of people who got the illness.
And that, by the way, is one of the reasons why when people were saying to a lot of people, my friends, they said, shouldn't we just try to get the swine flu? We'll have a swine flu party, and really, you might get away with it, but how can you recommend that when there were deaths? You could be one of the unlucky people who gets sick and even dies.
Right. There was a small fraction of people who did get serious illness, and so a far safer way to get protected using your immune system is to get the vaccine, and as we know, the vaccine is coming soon.
Now, about a third of people over the age of 60 seem to have antibodies, some protection against this virus, right? So this is different than the normal seasonal flu, which tends to affect older people, right? 90% of the deaths are, I guess, from people over the age of 60. This one, it affects young adults, kids.
Yeah, what was very striking about the illness we saw last spring was that it was very heavily concentrated in kids, and there were sort of intermediate rates in adults. We had almost no illness whatsoever in people 65 and older. Now, 65 and older are the people that we care about most with seasonal influenza, and so that pattern carries over to our recommendations for use of the vaccine going forward. The seasonal influenza vaccine, the most important people to receive it are people over the age of 65. But for the H1N1, we're recommending it for younger people and then non-elderly adults who have underlying medical conditions that put them at greater risk.
One misconception I've heard is that, just because you're less likely to get the swine flu, or this 2009 H1N1 as we're now wanting to call it, if you're less likely to get it over the age of 65, it doesn't mean that once you get it, you're okay. Once you get it, if you're over 65, you're still in one of these high-risk groups, right?
Yeah, if you're at risk, people are at risk if they have underlying medical conditions in their adult years. Again, for seasonal influenza, the elderly as well. But so the vaccination recommended groups differ for H1N1 vaccine versus seasonal flu vaccine.
And just to go over for people, the first group of people to be vaccinated are going to be pregnant women, healthcare workers or emergency personnel,
right.
People who are taking care of infants under the age of 6,
right.
Kids 6 months to 24,
right.
and then people 24 to 64 who have underlying medical conditions that may make them
right.
at increased risk. Now, that's about 160 million people we're talking about,
right.
and I just heard news that the CDC, which has approved Had 4 manufacturers
Yes,
today
that's
to
great
make the
news.
vaccine. Great. They made it more quickly than expected. They think the first batch will be ready around mid-October, about 45 million doses. So there's going to be not quite all that we need right away, but they think that very quickly after that they're going to be able to give everybody a vaccine who needs it.
Right, so we've estimated the allocations we'll be getting here in New York City, and we feel the same thing, that we won't be able to vaccinate everyone in that first week, but we're going to be getting shipments every week, and so very soon we'll be able to cover everyone in the groups that is recommended to receive it, which is a very comforting thing.
We'll be right back after this word from our sponsor. How important is social distancing and hand washing? Can you talk about that?
Well, we think people shouldn't panic about the sort of things that they're doing every day to come in contact with other people. We do think that people should be washing their hands. We do think people should be covering their cough so that they're not spreading infection to others. Last spring, when we didn't know much about this virus, there were some schools in New York City that we closed to try to protect the children. We know a lot more about it than we did last spring, and so we have going forward an open school policy here in New York City, where we are instructing parents to keep their children home if they're sick. If they get sick during the day, then they're going to be going to the nurse's station and waiting there till they're brought home. All the children will be taught the importance of washing their hands and covering their cough. And we think that we can limit the spread of infection in schools. And then we're also going to be offering the vaccine to children to protect them when the vaccine becomes available. And with all that, we think that it'll be rarely, if ever, that we would have to close the school this coming year.
How do you come about policy? How's that going to be decided, which schools get closed?
We have worked out, again, through our planning throughout the summer, a very clear protocol for how we'll deal with this. So we're tracking the number of kids who have influenza-like illness who come up to the nurse's office every day. We have 1,500 schools in New York City. That's going to be reported back electronically to our office every day. We're going to be posting that on the web every day so everyone can see what's going on in these schools. If we have more than 5 children in a day who have influenza-like illness, then we're going to be sending out repeated messages to the parents about keeping their children home and about the importance of hand washing to children in schools. If we get up to where we have more than 4% of children in a school on a given day with influenza-like illness, then we'll actually send people on site to that school to try to see why is it being spread in that school, what can we do to prevent that, are there vulnerable children there that we need to protect, and if so, how can we protect them? And only as a last resort, if we feel like we can't do any more infection control and we can't protect vulnerable children, would we consider school closure. But we think with all those steps, it's going to be very uncommon that we would have to do that.
Now, if a kid is home, there was some change in the recommendation. So the current CDC recommendation says keep the child home until 24 hours after the fever ends, without fever-lowering medication, right?
Right.
Now today some reports came out saying, well, theoretically the virus can linger for 7 days or longer, a couple of weeks even, after the person gets sick. So I called the CDC and I said, well, what about that? They said, well, look, you have to have a balance between what's practical and what's theoretically possible. Yes, theoretically you could get infected after a week or so, but in their studies it wasn't really that common. Is that what you're advising to?
The amount of the degree to which some child might be able to spread the infection to others is certainly going to decrease as the symptoms decrease. And so the common sense recommendation is 24 hours after symptoms, then a child can go back to school. This isn't going to shut off transmission totally from children, but it will very much slow it down. And again, this is a mild infection for the vast majority of children, and we have these other tools at our disposal. So I think that's a reasonable recommendation.
So some viewer questions, some nitty-gritty things,
sure.
Okay? Where should you sneeze? Into your hand, into your elbow, into somebody else's hat? Where do you sneeze?
We are recommending that children sneeze into a tissue or into their elbow, because if they sneeze into their hands, then they're going to be having the secretions on their hands, and then if they're touching another child, they're going to be spreading that infection. We're also recommending that children wash their hands if they are coughing or sneezing into their hands, because it's the secretions that spread the infection. They're the secretions that come out when you cough or sneeze, or if you get that on your hands. So yeah, a sleeve is something that we haven't been teaching parents in the past to do, but now probably makes sense.
Now here's something where it's kind of more theoretical, and I know there's not a lot of data available, but how about air travel? I mean, should people be worried about getting an airplane with people coughing and it's going? I know there are filtration systems that supposedly keep the virus out, but does it really work? And how do you think about that?
People feel in general that influenza is transmitted from one person to another through droplets, the things that just get out in the air and then they fall to the ground fairly quickly within a matter of a few feet. That it doesn't sort of fly around in the air and get into air systems and recirculate. Now, I can't say for sure that an airplane might not be a situation where there might not be some airborne spread, because that's a really a unique situation. I would think it would be unusual, and I think, again, it's worth coming back to this point that This appears to be milder than what we see every year with influenza, and most people are not afraid to fly during the winter season of their other years, and that the older people get, the less likely they are to get the infection.
Right.
So that the people who are the most vulnerable in general, the elderly, are going to be protected.
And I should say that, we can talk about the theory of whether you can get it through the air and aerosolization, all that, and there's some animal models showing that maybe you can, but I mean, practically, you got to live, right? You can't just be
Right.
in the cone of silence and be protected from the world. So
Yeah, in practical terms, where it really is spread is where there's crowding, where people are close to each other physically. And the kind of steps we recommended about washing your hands and covering your cough will help prevent that. Probably the most important thing, though, is if people are sick, that they stay home. That's not going to help them, but it's going to help everyone else. So maybe everyone can help each other out by, if you're sick, stay home.
all right. Well, on that practical advice that I believe either one of our mothers could have given us,
Probably.
right? It's glad that we're spending all these billions of dollars on this research and we're giving advice that our mothers could have given us. But it's practical, and I think when we don't have more data, I think that's really, what we're doing right now is we're a little bit flying by the seat of our pants, right?
Right.
But so far, the flight seems not too bumpy.
Right, we're doing fine. And again, we're very excited about the availability of the vaccine, and we're going to get it out there as soon as it's available to us.
All right. Any last words for the nation about H1N1 and about New York City's efforts?
And we've seen it in the spring. We've been planning hard over the summer. We certainly think we are fully prepared, if anything, over-prepared for its return in the fall and winter. And we'll watch and give lots of information to people as we go. If they want information, www.nyc.gov/flu. It's going to give them information, just content, and as well as data that they can track this closely.
All right, well, and I'll end with the fact that we know that the flu is unpredictable. That's the only thing that's predictable about it, is that unpredictable. But so far the news has been good. The vaccine, it seems like it only takes one dose. We got it made a little bit sooner maybe than we thought. It seems to be milder than it could have been. It's still not, it's still able to be handled by Tamiflu and Relenza, the most common antiviral agents. So far so good, but we're still keeping our fingers crossed because it could change. That is what flu does.
Right, we're watching it closely, and we'll be flexible, but we definitely feel that we're prepared.
All right. Well, thank you so much to Dr. Thomas Farley, who is our new Commissioner of the New York City Department of Health, and welcome to New York City.
Thanks very much.
And we hope you found that interesting in this discussion of H1N1. I'm Dr. Jon LaPook. Good day and good health.